For the anterior inferior shoulder dislocation maneuver, where the humeral head has gone subcoracoid, we want to do our pre-checks. Wiggle your fingers, all right? Squeeze my hand, and notice that I go to the patient and don't make them move to me. Relax. Tell me, am I touching you anywhere?
The wrist.
I'm touching you on the wrist, that's correct. Am I touching you where now?
Elbow.
On the elbow, correct. Am I just touching you now?
Pinching.
I'm pinching, so now we've got deep sensory pain there. We also check the pulse for normal frequency here. Once we're assured that all of those things are fairly normal, we want to grab the elbow and traction inferior on the humerus. We now grasp the wrist and watch the patient's face for any apprehension as we slowly externally rotate. If there is apprehension or a spasm, we stop suddenly and let it relax and go away before we continue. We keep our elbow in traction as we get into external rotation. We put the heel of the hand down in deep into the axilla so that the wrist is against the ribs. Then we flex the hand out with the ribs firmly against our wrist, and that should traction the humeral head. Now we use our hand as a fulcrum to move the elbow in and the humeral head out to clear the glenoid labrum, traction the subclavian artery and the brachial plexus. We lift together with both hands and then let the elbow out, and it suctions back in to the glenoid cavity. Once we've done that, the shoulder's restored. Now we do our post checks. Wiggle your fingers. All right, squeeze my hand. Check the pulse. Where am I touching you?
Wrist.
Where am I touching you?
Elbow.
And where am I touching you?
Pinching.
Oh, I'm pinching you, correct. So now all we have to do is tape the shoulder or put some form of support on it, at least holding it there for about a 6-week period with either taping or maybe a Sully shoulder stabilizer. And that takes care of the anterior inferior shoulder dislocation.